Hello and welcome to another episode of Learning Leadership 321 with myself, Brian Webster, and today we are joined by Paul Jebb. So, Paul's an amazing leader and has recently spoke at the RCNI Nursing Live conference in Liverpool, where I had the chance to meet him, which was really good. So, he currently works as Associate Chief Nurse for Experience, Engagement and Safeguarding at the Lancashire and South Cumbria NHS Foundation Trust. And he's also completed an MA in Health Service Management. So his blog, his bio is on over on the blog, so please do check that out. And let's jump right into the episode. So hi Paul, thanks very much for taking the time out of your day today, and we'll just jump right in, will we? So we'll start with a bit of gratitude. So what has made you smile today? And this is making me smile thinking about our previous chat. But what has made you smile today? What's made you grateful?
Hi, Brian, and thanks for inviting me along to this really important sort of area that we need to discuss more of. Um, I've had a busy week last week, I had a busy day yesterday, a really busy day this morning, with one thing and another. But this afternoon, and I'm currently sat in a place called Guild Lodge, which is our forensic inpatient service for the trust.
Oh yeah.
So medium and low secure. And I was invited here by a group called the Alphabet Group, which is the secure units LGBTQ plus support group.
Mhm.
And they invited me along because they were sharing stories, um, staff stories, and some of the service user stories as well. And it's led by one of the OTs who, is very creative and very arty, and does some amazing work in that field, and really makes a difference, and it is very valued by the service users here, because obviously he works with those people all the time, and he supported them in sharing their stories, and hearing stories from people who have been detained in a medium secure unit for whatever reason, um, going back to their childhood and how they weren't allowed to be themselves, and the challenges they faced in that was very emotional. And some of the stories about have been stuck in relationships that they couldn't get out of, or because of other people's beliefs and depend due to their lifestyle choices and their sexuality, was really emotional. But what made me smile was how people are coming through that, and part of that is sharing that story. And people's stories always make me smile because I think it's a really brave thing to do, but it's also what we need to do more of, especially across the NHS. We're obsessed with pathway and process and data, which is really important, but we also need to understand the person that's going through that process or that pathway or involved in that data, and we need to engage heart and mind. So the mind is the data, the mind is the process, but actually we need to look at the emotional aspects of care, the emotional aspects of people as emotional beings who are going through that process and that pathway, and really drive our care to be more and more person-centered rather than system-driven.
Yeah, definitely. But you can see how it's difficult though, can you? Especially you in your position as your job, but as well as your experience and insight as a leader, because if you take something like meal times, now obviously it's a massive institution, a hospital, so the meal time does kind of have to be at a set time, but if somebody doesn't want to eat at that time, it kind of throws that out the window, and they'll maybe get a banana, a sandwich, a biscuit if they're lucky, depending on the area. So you get that there has to be a level of, I guess, institutionalization, dare I use that word, for the system to work. But then, where does it, where's the happy medium between the person-centered? Just, if I want to have a shower at 2 in the morning and I'm in the acute ward, what's wrong with that? But because of staffing, that might not be possible because somebody's on, close observations, maybe in where you're sitting today, that might not be possible. So how do you get that happy medium? I don't know.
But it's how we get that flexibility in the system.
Mm.
So, if the tea trolley comes at 5 p.m. and actually someone's, asleep at that stage or not hungry, as you say, how can they access food at 8 p.m.
Mm.
without having to ring Deliveroo or wherever to get a takeaway, which we obviously know, isn't the best way every day to have food. So it's how we build that flexibility in the system, and it's the flexibility around the person that is needed.
Mhm.
and making sure that people have choice.
Yeah, yeah, I like that. Okay, so that's what's made you smile. Thank you very much. So the next part is I'm going to read you a quote, and I just want your sort of 10, 20, 30-second response to the quote. So it's a
That's
leadership quote.
brave.
It's by Simon Sinek, and he says, everyone could be a parent, everyone could be a leader, but that doesn't mean everyone should be a parent and everyone should be a leader. What do you think of that?
I think being a parent and a leader is probably right. I think leadership skills are within somebody, and it's how we develop them
Mhm.
and grow them. And some of that is the individuals, some of that is the system that they are in, and how that is supportive of them. Um, and I think, I think with parenthood and with being a leader and being a dad of three, being a dad of three adopted children as well, I think you can get into that nature nurture argument quite easily
You know.
around that. So, I would say you can see traits of me in all three of my kids.
Mhm.
Um, but biologically, they're not mine. That's, they've been with me all their lives, and with me and my wife all their lives. Um, and same with leadership. I've developed my leadership over many, many years through lived experience of different, being exposed to different things, through academic courses, through development, um, and that is sort of that nature nurture argument of, and a lot of people will ask, are you a born leader? Are you a do we develop in leadership? I think it's both.
Mhm.
And I think you can be a manager and not a leader as well. But you can't be a leader. No, that's the other way around. You can be a leader and not a manager, but you can't be a manager without having leadership skills.
So do you think all managers should be leaders?
I think all managers should have leadership skills,
Yeah, yeah,
not necessarily be the person who's identified as the leader.
yeah, that's a good point. Yeah. Okay, yeah. Perfect. Right. So 3 points on leadership. What's your top tips for the audience?
Um,
And if I take notes, please don't think, what the hell's he doing?
yeah, you're doing the crossword, I know. I think my 3 points on leadership are: always remember why you do what you do. So, and I say this when I speak to student nurses, when I speak to newly registered nurses, and go to welcome events and different things, and I was at an apprentice event a few weeks ago as well, and I was talking to them around, actually, always remember why you became a nurse. Always remember.
Become managers. Sorry to cut in there, just where I remember, because I remember one of my personal tutors at university saying, sometimes, and don't be offended, because the people who are office-based nurses are office-based nurses because they're crap nurses. And I thought, I don't believe that, but my experience and exposure to certain managers has reflected that a little bit. And you think they've lost that compassion and that care that's so important and that nurturing nature for nursing, that now they sit in an ivory tower and you think, I'm kind of glad you're not practicing clinically, and so, you know, yeah.
And I think that's really interesting. So there are lots of group of professional nurses who will say that about another group.
Mhm.
So, traditionally, educationalists were told, people go into education because they can't cope with the clinical practice, and I think it's all nonsense. I think it depends on what people's roles are in life, and I think if you speak to any one of my colleagues, I'm probably out and about more. I hate sitting in the office
Mhm.
because I think it's key that we get out and about. Hence, I'm not in my office today. I'm actually out and about and being on, the clinical floor, talking to service users, talking to carers, talking to staff, and people quite regularly say to me, "Do you miss nursing?" And I say, "I am still a nurse, and I still do nursing. I still interact with patients. I still interact with service users, but." And it's a point I'll come on to. I still interact with people. So going back to the values, it's understanding your values and understanding why you came into nursing as a profession, and making sure that as a leader you never forget that. So I've always had people at the heart of everything I do, even when I was, when I was 13 years of age, organising a holiday club in the local youth centre, when I was, this will make a lot of people laugh. When I was deputy head boy at school, when I was a holiday rep, it's always been about people and making a difference to people. And that's my big value. And that's what I always remember is, and I said this in the earlier question, it's about people. And everybody in the health service or in healthcare delivery should remember that what we do is about people. We've all got different roles and we do it from different angles. But at the end of the day, it's about people and making a difference to people's lives, whatever that looks like. It could be end of life care, it could be a comfortable death, or it could be a recovery journey that people are on for whatever reason. And that person-centeredness is key to what we do. And I think person-centered care is the thing that we need to constantly talk about, is how can we make a difference to that individual. So in our leadership roles, we need to remember how am I making a difference here? Whether you're looking at finance, whether you're looking at quality, whether you're looking at governance or whatever, bed numbers or staffing numbers or whatever that may be, how are you making a difference to people? And I think probably my third one is, we talk a lot around patient experience, and actually patient experience and staff experience go hand in hand. So we need to think about what we are doing and the impact that is having on patients, service users, carers, whatever label we put on people, how that is going to impact them, but how's that going to impact the staff as well. And for many years, if we're implementing or putting in another check or another bit of paper, we need to think about what we're going to take out. So we're not just piling things in for the sake of it. We're actually looking at how we do things better and making things as lean, to give it a label, as we can. And that's not just about putting more in, it's also taking things out that aren't of value.
It's a good point, actually. And I remember, again, to go back to university and education, the dean of the school had said to me, because I was the school president, I wouldn't be sitting here as dean without all you 350 nursing. Well, that was one cohort, but without the nursing students. And I often remember that, as horrible as the reason we need to nurse people generally is reactive nursing, isn't it? It's in the big hospitals and things, or like where you are today. But if it wasn't for, unfortunately, people being unwell, we wouldn't all be sitting in these jobs. So yeah, definitely.
Yeah, and and it is a shame, and we need to think about our roles in that reactive nursing care, but also in the prevention circle as well. And with the public health agenda, if you look at school nursing, health visiting, the prevention and the health promotion angles, we need to think about all that as well. And what is our role in that? Making every contact count, so we can really sort of look at health and people's health from a holistic point of view as well. And going back to the session I was at earlier today, it was interesting listening to some of those service users talk about their lives and how they are themselves and can be themselves and bring their whole selves. What one person said that many of the service users on the ward have asked them about their gender and their sexuality, but no staff have ever asked them. And it is how we understand people and the whole person. Sometimes it's uncomfortable for us to ask those questions. But if we're going to really deliver person-centered care and understand the person, we need to ask those questions and work out how we're going to ask those questions in a safe, secure way. Not necessarily in a checklist type questioning, but in a discussion. And we need to look at how we discuss things with patients, service users, people, and how we discuss with people what care they want to receive, how they want to receive it, and what's going to be best for them.
A good point, yeah, definitely. And I always find it strange that, but we don't tend to ask these questions off the cusp, and it tends to be because something happens. Again, it's a reactive thing, it's not a opportunistic thing. So yeah, we definitely need to get that better.
And sometimes it's because it's uncomfortable for us that
Yeah.
we do that. And we on a regular basis as nurses, we do uncomfortable things. So we need to think about how we look after ourselves, but also how we manage making sure that we are in that uncomfortable zone as well sometimes.
Yeah, that's good. Yeah, I remember when I worked in intensive care that one of the consultants there used to be a nurse, and he had went and did medical training, and he said, "Oh, us doctors who've been nurses are the worst doctors because we're too caring and too compassionate." Whereas I think he was arguing that most medical students and doctors are much more sort of, fire in and do this,
Yeah,
that, and the next thing.
yeah.
But
And the medicine model and the nursing model are two very different models of care. So, you can understand why that happens. But, we need to break down some of that. And I've been a great advocate for many years, when I was doing, the student activism stuff around actually we need to have multi-professional education.
Mhm.
And there are sessions within curriculums, whether that's medicine, whether that's therapy, whether it's nursing, whether it's dentists or whoever, where actually we all need to come together to do that training together and have multi-professional sessions on that communication, for example, or we all should be learning and the same sort of stuff, so we're all on the same song sheet.
Mhm.
So I'm a great advocate for doing that as well.
Definitely. Okay, look, thanks very much for those. So we'll jump on to your good leadership examples. So it could be ones that stand out, it could be recent ones, it could be, you know, anything.
Um, I've been thinking about this, and I find this question really hard because I know absolutely thousands of absolutely exceptional leaders from nursing, from nurse education, from medicine, from therapists, in sort of general management roles. And I think there's several I could look at, but when I look at different things, it's where that leader has been interested in the person.
Mm.
So, 12, 18 months ago, my stepmom died and passed
Gosh.
away. And she was looked after at home, and I was there with my dad and her family as well. And obviously, once she'd passed, then you know, it was midweek, so I was still at work, and I carried on working.
Mhm.
And the chief exec was the person who said to me, "Why are you still here? Why are you at work?
Right.
Are you okay?" And I was fine. I'm very sort of black and white that, that my stepmom had died and there's nothing I could do. So it's a process that you got to go through. And I was obviously supporting my dad and things, but there's nothing
Mhm.
else I could do. So why not go to work? And I was fine. But that's the first time I've actually thought, actually, we are changing the healthcare environment and the culture around that, because actually senior leaders are caring about people.
Good.
And I think that has stuck with me around that, and obviously fits with my values from what I said earlier around people and delivering care to people and person-centered care, and remembering of the person. So I think that is probably the most high, the highest one I can think of at the minute.
Mhm.
Over years, and I remember being a student nurse and working with a ward manager who I actually never ever saw come from behind the nurses station.
Right.
And I used to think, do I want to be a nurse like that? Or don't I? I like getting out and about, and I like seeing people, and I like being with people. But she never came from behind the nurses station. But she knew absolutely everything about those 30 patients
Right.
and hadn't moved from the nurses station. And I just thought, how does she do that first to start with? It's relying on the team to tell you things, and making sure you're on top of your game with the multidisciplinary team. But actually, I'm not sure if I could have done that without actually going around every single patient to say hello and different things as well, without actually knowing the patient as a person,
Mhm.
and knowing what matters to them and who matters to them, um, as part of that. So, I think we all come across people who we see and we watch and we work with and think, yeah, you've taught me a lot, but you've taught me what not to do. But we've all worked with those amazing people who have taught us actually how to be and how to be amazing.
Mhm.
And I think, as you've seen from my bio and things, being in that political arena as well really helped me sort of develop some of those ideas and some of that, how people influence and how people discuss and debate things. It was key as well in different angles. Um, you know, Christine Hancock as General Secretary of the RCN at the time, when I was chair of the student body there, really taught me a lot around that political activism and how nurses can be political.
Mhm.
And I remember her saying to me once that, nurses will never be taken seriously unless they sit on the front row
Mm.
or they ask a question. And if you look at, and ever since then, I've always looked at my audiences and audiences I've been in and things, and thought, actually, as nurses, we do all congregate to the middle or the back. I'm the worst. And actually, we don't like asking questions as well. We don't like putting our hand up and putting ourselves forward and putting our head above the parapet. And I just thought that was really stark as well. And as I've gone through the last 30 years, that still happens. So,
Mhm.
as we go through all the challenges that nursing has at the minute, we need to get to the front row. We need to take our chair to that table, and we need to put our head above the parapet and ask the questions, whatever arena that's in.
Definitely. And when you look at how many registrants are on, the NMC register, that voice, if it was collective, would be astronomical, wouldn't it?
Absolutely. You think, what, 750,000 registered nurses and nursing associates? If we use our collective voice, we would make a massive difference to healthcare in this country.
Right. So how would you encourage people to do it then? Because the program Breathtaking that was on the television not long ago about the pandemic, and the chap says to the doctor, the NHS eats whistleblowers alive, which is probably quite true when we look at mid-staffs and stuff, but not even the maybe formality of whistleblowing, but speaking. Up is scary. So what's your advice for that?
I think speaking up is scary if the culture you're speaking up in is wrong.
Mm. Hmm.
If you're in a safe, psychological safe culture and in an organization that encourages feedback, that encourages involvement, that encourages change, then speaking up isn't as difficult as it has been in different organizations. And I don't think you need to go back as far as mid-staffs to look at where whistleblowers have been failed by organizations or individuals. We've got recent cases of that as well. There's a lot of work to do in around workplace culture and healthcare culture as well.
Definitely. I was at a conference not that long ago, and there was a speaker, and so there was three of us, and one of the audience had said, quite emotionally and quite bravely, said that, the question was about a toxic workplace, and what do you do? They had raised a concern and then became victimized. And unfortunately, obviously, they'd reported it and it just got worse and worse and worse. So the advice probably would have been to take yourself away from the situation, to leave that culture. But she made a great point that, well, I loved that job. If you take away the staff, that was my, dream job, loved the job, loved the area. She didn't say what it was or anything. And it was a good point because I thought that tends to be, remove yourself from the situation. But why should you, remove
Absolutely.
yourself? But then I don't know what the answer is to that, Paul. But
And that is that organizational workplace culture that
Mhm.
is wrong. And I think there's lots of people who have been at the end of really horrible cultures. I know I have. I know I've had people ask me or tell me they'll meet me on the car park and things like that. Um,
Jesus.
but it takes a very strong person to do that who has got strong support around them.
Mhm.
Um, and that is the key thing that we as individuals, as people, as emotional beings, we need to make sure that we are supported when speaking out, but also through our day-to-day general workplace events. We need to make sure that we're supported. Because we work we are emotional beings who are looking after emotional beings at a very vulnerable time,
Mhm.
and we need to make sure that we are supported um, in doing that. And whether that's clinical supervision, whether that's mentorship, whether that's coaching, or whether it's just a friend or family member's shoulder to cry on and have that discussion with. We all need to find our safe space to be able to do that, to get the support that we have, because as I said earlier, happy staff make happy patients. And I've said that lots of times, and I've tweeted about that and different things. So we need to remember that. We need to look after ourselves. Organizations need to look after us as staff as well, so we're able to do our jobs to the best of our abilities.
That probably takes me nicely on to your leadership style. So I guess you'll tell us your leadership style, but how do you support then, and how do you nurture the people that look to you as a leader? And what is your leadership style?
I think I'm quite a democratic leader, I think. And I want to, I talk a lot around co-production with service users and patients and people and carers, etc. So, I like to do that. I like to role model that myself. I'm not autocratic one bit, but there are situations where your leadership style needs to change, and there are situations where you need to change that style. Yeah, I'm not a shouter, I'm not a bowler, but when I'm being stern, people know I'm being stern. And yeah, leadership is about flexibility as well. We need to flex our style in doing some of that. And I would hope that the people I line manage and the teams I lead would say that I always make time for them, and I always make time for them to talk to me and to listen. And I will listen, and I will, I wouldn't necessarily act on their behalf, but I will support them and help them in ways they want to act and do things. But it's key that we make time for each other to give people that space.
And it goes back to that sister that you're talking about sitting at the end of the ward. And sometimes a good leader will do that. And you see that in these programs like, 24 hours in A&E. And the consultant, for example, who clinically will be the lead, will stand at the end of the bed and let everyone do everything and maybe give a bit of direction. So sometimes you do need that, but then
Yeah,
other
yeah,
times
absolutely.
you do need to step in and be like, right, I'm going to do this and I'm going to do that. Yeah,
Yeah.
definitely.
Absolutely. And we need to show both sides as leaders
Hmm.
in that as well. And sometimes it's good for people to see alternative leadership styles coming out through people, because then that's where they understand the person and respect them as a leader as well.
Hmm. Yeah. And
But
so the NMC suggests or implies that we should all be leaderly, or I don't know what the wording is exactly, but what do you think of that? Do you think that's too much of an expectation when you're a newly qualified and you've just finished university and you're thrown into the deep end? How would you advise, or what would your advice be for new nurses to be showing leadership amongst everything else? Maybe their clinical supervision and their mentorship, and we've got in Scotland the preceptorship called Flying Star, but I think it's different where you guys are from in England. But
yeah.
how do you
Uh,
juggle all that as well as being that leader, and not the manager, but the leader,
yeah.
and leading your colleagues and your those, to the side and things.
I think as nurses we all do leadership naturally.
Hmm.
So if you're looking after a you know a caseload of patients, you are leading their care, you are coordinating their care. So you are a leader. Um, when I was a healthcare assistant, I was a leader. I was, I worked in a nursing home, and I was doing that care. So I was leading those healthcare assistants who were more junior than me, and directing them and supporting them through that. And it's interesting, and seeing my son now. He's just started as a healthcare assistant in an acute trust, and he was out the other night at a party, and he rang me and just say, "Dad, someone's fallen ill." Um, so I've gone in with the skills I have, bearing in mind he's only done 5 shifts, so he's probably at matron level already. Being sarcastic there, and
See one,
he
do one, teach one,
basically,
isn't it?
yeah, absolutely. So he was like, and I don't know whether to ring an ambulance or to ring the parents. What do I do, Dad? I'm trying to support her, and that's when I thought, actually, yeah, that leadership skill is coming through around just being in there and being the calm person who's taking control and supporting a person. And I think that's what we all do as healthcare assistants, as registered nurses, as nursing associates, etc. We all do that from time to time.
Hmm.
Whether that's teaching someone how to use an insulin pen, or whether it's teaching someone how to put their socks and shoes on once if they've had a stroke, or whatever that may be. They are all leadership skills.
Definitely. And when I looked into the styles that you sent, so the transformational and the democratic, so it talks about self development being key. So what do you think about that? How do you self-develop yourself as a transformational and democratic leader?
I think we're all in charge of our own destiny.
Hmm.
So we need to think about how we're going to develop ourselves to be the best we can, um, and how we get there using how we transform ourselves but also, the situations and the people around us as well. But also as nurses, we need to work together to do some of that stuff as well. And I thought it was something else, and it's totally gone out of my head.
Sorry, I just got a message to say we've got 10 minutes left. I was going to say, is there a ceiling to leadership? I know the answer to this from you, but
No.
no. Is there a ceiling to nursing?
I think there are things put in people's way for different reasons,
Hmm.
which may be a glass ceiling, um, and I think that's probably a debate in itself on what causes the glass ceiling. But I think as nurses, as the wider nursing profession, we are the most valued in the eyes of the public. We are safety critical. We are evidence based. And we need to use our collective voice to shout that from the hilltops, especially as we're moving towards a general election as well. And I had a very similar debate with my mother-in-law, who reads a certain paper that I shan't name, who basically said to me that there's a crisis in nursing because nurses are all in university. And that turned into quite, I won't say heated, but there was a debate around that as well, as around, what does a profession mean? What are we as professionals? And actually, why should nurses not have a degree when OTs have a degree, physios have a degree, doctors have a degree, and nursing doesn't have a monopoly on care. And we need to make sure that what we do in a caring, compassionate way actually is the safety critical stuff, the evidence-based stuff, the research-based, the theoretical knowledge that comes behind that. That's what makes us a registered nurse. And that's what we need to value as we're moving forward in quite challenging times. If you look at recruitment and retention, and we need to remember that, and we need to be able to articulate that to our family in this case, but also wider members of the public and those people in power.
Definitely. That seems like a great place to end. But I'm going to ask you one more thing about gratitude. So when you go to bed tonight, what's your most thing you're grateful for in your life?
When I go to bed tonight, I'll have walked my dog, I'll have been to pick my son up after his healthcare assistant shift, and I'll get home and I will probably be the first into bed before all the kids. But I will be happy that I have got 3 amazing kids and an amazing wife who are there to support me and who are caring, grounded individuals.
Brilliant. Well, thanks very much, Paul, for taking the time today.
No, thanks, Brian. Been good.
Great. So it was great to meet Paul today, where we chatted about all things leadership, his leadership styles being democratic and transformational, and we chatted about his 3 amazing points on leadership and what you can do to make yourself a better leader, and then his 2 leadership examples. So please do check those out, and I hope you enjoy, and we'll see you next time. Cheers, bye.